Hello everyone, welcome to Medigac. Today we are going to discuss about proximal femur fracture. Proximal femur fracture is fracture in the upper quarter of the femur, near the hip joint. This type of fracture can occur due to older age, which leads to osteoporosis. In younger age also can be seen due to injury. We will discuss this topic dividing into 5 parts, that is, clinical features, mechanism and classification, diagnosis, treatment, and complications. Now, let's discuss the clinical features of the injury. This includes swelling of the injured area, pain around the affected area, and external rotation deformity. Now, let's discuss the clinical features of the injury. This includes swelling of the injured area, pain around the affected area, and external rotation deformity. Now come to the mechanism of fracture. In case of mechanism, this can occur due to: in adults, RTA is commonest one, fall from height, machine injury, and gunshot injury. In children, fall from height and birth injury. Now come to the classification of proximal femur fracture. This is also known as Seinsheimer's classification. This includes Type 1, Type 2, A and B, Type 3, A and B, Type 4, Type 5. This is Type 1 fracture. It means when the fracture is localized or undisplaced. This is Type 2 fracture. Type 2A, this means when the fracture is below the lesser trochanter. Type 2B, this means when the fracture is above the lesser trochanter. This is Type 3 fracture. Type 3A, here lesser trochanter becomes third fragment. Type 3B, here fragment from original fracture line becomes third fragment. This is Type 4 fracture. Here along with Type 3, another fragment joins and becomes 4-part fracture. This is Type 5 fracture. Here along with Type 4, subtrochanteric comminuted fracture with intertrochanteric extension. Now let's discuss the diagnosis part. X-ray helps to diagnose the fracture and severity of it. According to place and depth of fracture, it can be classified by looking the X-ray. Pulse checking. Presence of popliteal pulse means no vascular damage, CRT. If it is less than 2 seconds, that means no vascular injury occurred. Toe movement. This suggests no nerve injury. Now the final part, that is treatment. Treatment is mainly done by conservative and surgical methods. In conservative treatment, if the patient is young, we mainly try to use modified cast brace with pelvic band. In surgical treatment, this is done in case of adults and ORIF, open reduction and internal fixation. Various surgeries are used in internal fixation: proximal femoral nail, dynamic condylar plate, condylar blade plate and dynamic condylar screw, spiral blade plate are used. Surgical implants we mainly use are low transverse fracture and short oblique fracture with 1 degree intact cortex. For this we use intramedullary nail or an interlocking nail. In fracture above this level without trochanteric extension, for this we use locking nail or Zickel nail. In fracture above this level with trochanteric extension, for this we use sliding compression, hip screw, bone graft is used. Now come to the complications part. Complications are malunion. When conservative treatment is done, there remains high chance of malunion. Secondary osteoarthritis of the hip, shortening of bone. Due to altered weight-bearing mechanism and limping, the patient may feel contralateral hip and knee pain.